All right, Shannon. So I would love to spend a couple minutes talking with you about what we saw on both your radiographs and kind of when we looked in your mouth, and then talk a little bit about what our options might be. How does that sound to you?
Perfect.
Cool. So one of the things that we did see, we saw this on your radiograph, we looked at it a little bit earlier, but we saw this small little cavity. And cavities are kind of like rust on metal. So there's like, when the rust starts on the metal, there's no hole, but then that rust gets bad enough where there's eventually a hole. And the good part about cavities is when that rust is essentially there and there's no hole, we can often stop that cavity, reverse it, so that you don't need a filling. We know that from the evidence, it's probably, it's really, really small at the beginning, certainly less than probably a 10% chance here that there's a hole in that tooth. And so our options here would be, first of all, there's this liquid that we kind of paint on your teeth. It's called silver diamine fluoride. Name's not super important, but what we do is we paint it on there. We put some floss in there and kind of move it around a little bit. And then that sits on there and we cover that up with some fluoride varnish, which is the tasty stuff that we put on your mouth at the end of the appointment. And that can help stop the cavities. There's good evidence that can help stop the cavity. The second thing that we could do is we could do a filling. If there is a hole in the tooth, that could be something that we could do. That depends on your, comfort with that risk of there being a hole there or not. The third thing we could do is maybe get you some stronger toothpaste and potentially try that way too. We could also do a couple of those things in conjunction with each other. We could do the silver diamine fluoride and the strong toothpaste if you wanted to do everything possible. So there's a few different options there. Thinking through those, I wonder if you have a sense of what you feel like might be most helpful.
So if I have the silver fluoride,
Mm-hmm.
you think I don't need a filling?
That is generally what we see. If we do that, we can do it once now, maybe once again in a couple weeks, put it on twice. There's pretty good evidence that most cavities stop when we do that. So that's in all likelihood, that would be what would happen. So what are your thoughts?
I'd rather not have a filling, so I guess I would try the silver.
Okay. So maybe the silver is on there. One of the good things about the silver that I haven't mentioned yet is that it actually, there's evidence that shows that it can prevent other cavities in the mouth as well. So it's not only good for that one tooth, but it can actually have a preventative effect elsewhere, which is pretty cool.
Wow.
So that is one thing out there. The one negative is that it tends to, where there is an active cavity, it tends to turn the teeth black. And I can show you pictures of that and whatnot.
Okay.
But this is between your teeth. And so I can't even see it when I look into your mouth. So certainly not something that you would see when you would look in your mouth. But if it were your front tooth,
Right.
on your front, you would see it black. But that's not going to be the case for you here. So it's really the biggest risk for most people is that this kind of aesthetic effect of it turning black. But
as long as you can't see it.
then you'd be fine with it.
Okay.
Okay, cool. So you're thinking the silver diamine fluoride, put it on in there, and you maybe would be willing to come back in 2 weeks, it sounds like, to maybe get it on there a couple
If that
times.
avoids a filling, I think that would be good.
That's your biggest thing, is to avoid that filling, it sounds like. Okay, cool. Well, we'd be happy to try that. We can take a look, when you come back for your recall exam, we can take a look, take a new x-ray, see how that looks, and we can go from there.
Okay, perfect.
Great. Well, thanks for chatting with me about it.
Yeah, thank you.
Yeah.